Iain Lees-Galloway.
Thank you very much, Mr Speaker. As my colleague Ruth Dyson has already said, Labor supports this bill. The Substance Addiction Compulsory Assessment and Treatment Bill is a much-needed update to the Alcoholism and Drug Addiction Act of 1966, which had become completely outdated, outmoded, reflected the attitudes of the time, reflected the knowledge of addiction of the time, and was in desperate need of being brought into the 21st century, which this legislation does do. We certainly acknowledge the sensitivities that need to be addressed with this type of legislation. This is legislation that does allow for people's freedom to be taken from them, for people to be compulsorily taken into treatment, perhaps in some cases against their will, often perhaps against their will. And so there has to be a very, very high bar. There has to be an extremely high threshold for the application of this legislation. And in fact, the advice that members had at the Select Committee was that it should lead to, or it's likely to lead to, around 200 orders per year. Now that's an increase on the number of people who are usually taken in for compulsory treatment of addiction. And as has been pointed out, that requires some resource to go alongside it. And I guess the concern on this side of the House is that not only is the overall health sector underfunded, we know that because of the government's failure to keep pace with inflationary costs and the growth in population, that there's about $1.7 billion missing from the health sector overall. But also the fact that for the entire 8 years of this government, mental health and addictions have not been one of their health priorities. And that has meant that district health boards have focused on the priority areas, the ones that are published in the newspaper with those big glossy advertisements, and have not been able to put the focus that they want to into mental health and addiction services, because they are starved for cash. They have to prioritise. The government has made it clear what their priorities are, and mental health and addictions have not been a priority for this government. So it's one thing to change the law, and we applaud the government in changing the law, and we support changing the law. But for this law to be effective, the government has got to ensure that DHBs have the resources they need.
Order. I apologise to the member for interrupting his speech. This debate is interrupted and set down for resumption next sitting day. The House stands adjourned until 2 p.m. tomorrow.